Hello and welcome. Today we're diving deep into a condition that affects male reproductive and urinary health: retrograde ejaculation. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. Buckle up as we're about to embark on an informative journey. So, what causes this condition? Retrograde ejaculation stems from a problem with the bladder neck's functionality during ejaculation. Normally, when a man climaxes, the bladder neck muscle clamps tightly shut, preventing semen from entering the bladder. Instead, the semen is propelled forward, out of the penis. However, when this muscle doesn't close properly or is impaired, the semen takes the path of least resistance and flows backward into the bladder. Several factors can contribute to this malfunction. Nerve damage is a common culprit, often resulting from conditions like diabetes, multiple sclerosis, or spinal cord injuries. Certain medications, especially alpha blockers used to treat enlarged prostate or high blood pressure, can also relax the bladder neck muscle. Prostate surgery, particularly transurethral resection of the prostate or TARP, can sometimes damage the bladder neck, and, in rare cases, retrograde ejaculation can be a side effect of radiation therapy to the pelvic area. Let's break down the pathophysiology. As we discussed, the crucial component is the bladder neck, a ring of muscle at the junction of the bladder and the urethra. Its proper contraction is essential for normal ejaculation. This contraction is controlled by the sympathetic nervous system. When this system is compromised, whether due to nerve damage, medication interference, or surgical complications, the bladder neck's ability to contract effectively is impaired. This allows the semen to flow backwards into the bladder instead of being expelled through the urethra. The semen then mixes with urine and is later eliminated during urination. The degree of retrograde ejaculation can vary. In some cases, only a small amount of semen flows backward, while in others, nearly all of it does. Understanding how common something is very important. In terms of epidemiology, precise numbers for retrograde ejaculation are difficult to obtain because many men may not seek medical attention if it doesn't significantly affect their quality of life or fertility goals. That being said, it's believed to be more common in men with diabetes, particularly those with poorly controlled blood sugar levels. Men who have undergone prostate surgery or who are taking certain medications, especially alpha blockers, are also at higher risk. Prevalence also increases with age. Therefore, while a specific prevalence rate is hard to pin down, it's important to recognize that retrograde ejaculation is a condition that can affect a significant portion of the male population, especially those with certain underlying health conditions or risk factors. So, how does someone know if they might have retrograde ejaculation? The most obvious sign is producing little to no semen during ejaculation, often referred to as a dry orgasm. However, it's important to note that dry orgasms can also be caused by other conditions. Another key symptom is cloudy urine after ejaculation. This is because the semen that flowed backward into the bladder is now mixed with the urine. Some men may also experience reduced fertility, as the sperm isn't being properly delivered to the female reproductive tract. It's important to consult a healthcare professional if you suspect you have retrograde ejaculation, as they can properly diagnose the condition and rule out other potential causes of your symptoms. Diagnosing retrograde ejaculation typically involves a combination of physical exam and laboratory testing. Your doctor will likely ask about your medical history, including any underlying health conditions, medications you're taking, and previous surgeries. A urine sample will be collected after ejaculation to check for the presence of sperm. A significant amount of sperm in the post-ejaculatory urine confirms the diagnosis of retrograde ejaculation. Additional tests may be performed to rule out other causes of dry orgasm, such as ejaculatory duct obstruction or hormonal imbalances. Your doctor may also order tests to assess the function of your bladder neck muscle. While there aren't distinct types of retrograde ejaculation in the same way you might classify cancer stages, the severity can vary. The condition can be classified based on the degree of semen that enters the bladder: mild, moderate, or severe. Some individuals experience partial retrograde ejaculation, where a portion of semen is still expelled normally, while others experience complete retrograde ejaculation, where all the semen flows backward into the bladder. The clinical implications of these differing severities relate primarily to fertility. Complete retrograde ejaculation presents a greater challenge to conception than partial retrograde ejaculation. The primary goal of treatment is to improve semen emission during ejaculation and, if necessary, to address fertility concerns. If medication is the cause, your doctor may recommend adjusting the dosage or switching to a different medication. In some cases, medications like pseudoephedrine or imipramine, which can tighten the bladder neck muscle, may be prescribed. However, These medications have potential side effects and aren't suitable for everyone. For men who desire to have children, assisted reproductive techniques such as sperm retrieval from the urine followed by intrauterine insemination as AU or in vitro fertilizations IVFF may be necessary. In rare cases, surgery to reconstruct the bladder neck may be considered, but this is typically reserved for severe cases where other treatments have failed. Preventing retrograde ejaculation is often difficult, especially when it's caused by underlying medical conditions or necessary medications. However, controlling risk factors such as diabetes by maintaining healthy blood sugar levels can help reduce the risk of nerve damage. Discussing potential side effects with your doctor before starting new medications, particularly alpha blockers, is also important. If you're scheduled for prostate surgery, ask your surgeon about the risk of retrograde ejaculation and explore alternative surgical techniques that may minimize this risk. Regular check-ups with your doctor can help identify and manage potential risk factors. The prognosis for retrograde ejaculation is generally good, particularly if it's caused by reversible factors like medications. In many cases, the condition doesn't require treatment unless it's affecting fertility or causing significant distress. Assisted reproductive techniques offer excellent chances of conception for men who desire to have children. Ongoing research is exploring new and improved methods for treating and managing retrograde ejaculation. Studies are investigating the potential of novel medications to improve bladder neck function and reduce retrograde flow. Additionally, advancements in sperm retrieval and assisted reproductive technologies are continually improving the chances of successful conception for men with this condition.